Hi everyone, welcome to my channel. So in this video, students have took a case about hypertension on government hospital, and they have clearly presented about the disease condition, history, past history, and what is the prognosis of the patient is clearly explained, and the anatomy and physiology of the hypertension and the home care management is everything clearly explained in this video. So have a look on it.
Good afternoon everyone. Myself I am Anupratha from 3rd year BSc Nursing, 5th semester. As a part of my clinical posting, I was posted in government hospital. Here I saw my patient Mr. Sekhar, 46 years old, male patient, and he had a chief complaints of headache, dizziness for the past 2 weeks, and then sometimes feels tired easily, and then fast heartbeat palpitations. History of personal illness: Mr. Sekhar has a headache and dizziness for the last two weeks. It is slowly increases to the few months, and then he had heartbeat fasting, rapidly palpitations, and then history of past illness, no history of diabetes mellitus, asthma, kidney disease, and alcohol or drug uses. And through the chief complaints, we check the physical examination. In the physical examination, through the vital signs, Mr. Sekhar's vital signs, blood pressure is 160 by 100 mmHg, and he is overweight. BMI was 28 kg meter square, and the diagnostic evaluations are blood pressure measurement, physical examination, laboratory test, and then diagnostic evaluations like WBC count, RBC count, and then ask about signs and symptoms. The doctor was asked about the signs and symptoms like what are how many days you have headache and dizziness, like that, and then through the chief complaints and the diagnostic evaluation with the physical examination, the doctor diagnosed the condition as the hypertension. The medications are prescribed by the doctor as amlodipine 5 mg once daily, lisinopril 10 mg once daily, and then the lifestyle modification. The doctor and nurses educate about the patient to eat low salt diet 5 gram per day, and then regular follow up of their condition, and then like for lifestyle modification to reduce the stress level, yoga, meditation for the procedures, and then avoid the junk foods, eat healthy foods with low fat and low salt, and then nursing management. The nurse should advise the patient about regular checkup to the doctor, and then eat food with low salt and low fat to reduce the stress, to do meditation and yoga and exercise, do regular exercise like 30 minutes per week, 3 days, and then home care management, check BP regularly, and eat low fat and low salt foods, and then advise the patient to regular follow up to the doctor, and then do exercise regularly, and to reduce the stress, exercise, meditations, yoga. Conclusion: hypertension is a complicated, lead to serious disease condition. If not treated, means it goes under heart diseases. Hypertension treated with the symptoms and chief complaints through the physical examination. Definition of hypertension: hypertension is a condition which is usually the blood pressure in the arteries persistently high, usually 140 by 90 mmHg. The causes of lack of physical activity, stress, alcohol consumption, smoking, that are, and then the complications are heart disease, stroke, kidney damage, vision problems. The nursing diagnosis are ineffective tissue, and then anxiety related to the What is the definition of hypertension?
Increased blood pressure in the artery, usually 140/60 mmHg.
And then what is the normal range in the hypertension?
Normal blood pressure 120/80 mmHg. In hypertension 140/60 mmHg.
What are the causes in hypertension?
Lack of physical activity, stress, alcohol consumption, smoking.
And then what are the complications in hypertension?
Heart disease, stroke, kidney damage, vision problems.
Thank you.
Subscribe to our man channel Shine with Channel.